Hello, I'm Dr. Tom Groover from Groover Chiropractic Clinic in Boulder, Colorado, and I'm here with Dr. Judd from Dr. Judd Institute. Welcome.
Thank you.
I have Dr. Judd here because I think he's an extraordinary person. He seems to have escaped from the reservation of conventional medicine, mind-body medicine. Dr. Judd, you're a former University of Colorado running back, is that right?
Yes, sir.
Yeah, and what years did you play?
98 to 2001.
Right.
We won the championship 2001.
Yeah.
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 Good
Yeah,
times.
and I remember some of those great games. And you have had a very interesting journey throughout life. I know that you've told me a little bit about it, but let's go back a little bit to your childhood. And my understanding is that you played football in high school, like most kids, right?
I did. I actually, being from right outside Nashville, Tennessee, we started at a very young age, and we were in football pads, probably early grade school. Pretty rough contact, everyone pretty competitive at that level, that part of the country, for sure.
So there's that grade school experience, and then obviously you went through middle school, or what in my era was junior high school.
Correct, yeah. I went to a military academy, so that was a pretty high level of competition with guys like Eddie George, Vinny Testaverde, former Heisman Trophy winners. It was a good time. It was intense football at a very high level. Yeah.
And then did you go straight to college, or did you go through the junior college system first?
No, I went straight to college. I actually went straight from the military academy, even joined summer school training and took classes so I could be adapted as quickly as possible.
Okay.
Yeah, I took it pretty serious. Yeah.
All right, so probably at that point, that's what you were thinking about, is an entire life of football.
Yes, it is. I mean, granted, I walked on and earned my way, but a kid at that age, you can't tell them anything but that you're going to do this your whole life.
Right.
You know, I loved contact. I love sports. I love the camaraderie of teamwork and ethic and everything. So
Yeah.
I knew nothing else. You know,
Right.
School was cool. You
Yeah.
know, and I always knew I wanted to get into psychology. At the same time, football was awesome. You know.
So you actually had in mind that there was a life after football.
I did. I was sort of grasp that. I know that sounds like a contradiction, but I always knew eventually I would go in the field of mental health.
Ah, nice. Yeah. Okay. And so then when you left the University of Colorado, graduated there, then you went to some graduate school.
I did. And before that journey really took off, I was in really a limbo with my health, because it was hard to focus on grad school or really anything because I was walking around in chronic pain,
Right.
mentally and physical.
Yeah.
The military academy prepared me for the transitions from high school to college. Nothing prepared me for the transition of college into my professional life.
Right.
You'd like to think that it would. No one can really prepare you, and I guess that's a huge part of what we're doing now, is how do you help young people or anybody that's walking around in a chronic state of pain mentally and physically, because they are synonymous.
Right.
How do they adapt once they get away from what they've always known?
Yeah. So for anyone who understands contact sports, chronic pain after completing college participation at that level, you kind of understand that, but could you explain how you ended up being in chronic pain?
I will. From the I think my first major injury was my AC joint separation, and that I always thought I was indestructible.
Yeah.
You know, and everyone is at a young age, and you think, oh, this, you know, separation of this, and you kind of understand it, and you're like, oh, I'll just rehab it and I'll be completely fine.
Right.
And I was the type of player, I never missed a single practice or game. And so then my quad rips a little bit, and then it rips in half and it rattles up my hip.
Right.
And my biceps tendon rips. And then before I know it, by my sophomore year, I had this shoulder basically reconstructed. I had the quad reattached. And by my senior year, I'd had at least 4 surgeries. And so when we're talking about chronic pain, I'm also wanting to reference really the state of toxicity that was going on in my body emotionally and with the medication. Because if you've never had surgery before, you don't really know what's going on when people are saying, like, take these painkillers, take these prescription anti-inflammatories. And I know this is funny to imagine now, but at the time I remember taking off my helmet and just handfuls of hair being in my helmet. And I really think it was just my body rejecting all those medications.
Right.
I couldn't think clearly, and granted, that's complemented with concussions, and you know, cognitions are definitely disturbed whenever you're hitting your head violently against another human being or anything. Right.
Yeah.
But I think that pretty much sums up where I was at the end, because you have this, what do I do now? I thought I prepared myself for after, and then it's, I'm in so much pain, I don't know how to heal myself, and I don't know what life looks like now.
Right.
Yeah.
Yeah. So that gets into kind of some of your current work, which has a lot to do with handling trauma.
Yes.
And that's how we met, because that's the focus of my work.
Correct.
Is dealing with trauma. And so let's do a little bit of a definition. What do we mean by trauma?
Trauma.
Yeah. What do we mean by trauma? And of course, as a psychologist, you realize that there's a mind-body connection there.
Right.
Okay.
You would hope that most clinical professions in the mental health field recognize that.
Not.
That's the goal.
Yeah.
Right.
So then what happens is, you know, your body gets hit. Now, from my experience with sports, which is not nearly anything like yours, but I mean, I remember the highly emotionally charged moments.
Right.
And I remember, for instance, and this is silly, I know, for me to go into my childhood history, but
Now let's do it.
I played football in high school. I was the captain of my little football team, and I was a tackle. I was one of the biggest, strongest guys on my team, and I only weighed 165 pounds.
Right.
Okay. But we played the school over on the mainland. I lived on the ocean side,
Right.
in Daytona Beach, Florida. And it was a real important game, and we decided we would put in a trick play, and I would be tackle eligible.
Okay.
So in one practice, they're running me to death. Like, this is how you run your route. You're gonna, you know, go over this way. It has to be just the right angle. You have to keep running, and
Right.
then, you know, the ball, you'll get clear, and the quarterback will throw you the ball.
Right.
So they ran the tackle eligible play on the 10-yard line. We were, you know, like first and goal or something like that. And I ran, and I realized, what do I do now? I'm in the end zone.
Right.
So I couldn't just keep running. I mean, I could have run across the end zone, or I could have run back to the quarterback and then run again.
Right.
So I just turned around and stood there. I said, jumped up and down and raised my arms up in the air, you know, and the ball went over my head, you know. And I remember that clear as day. But at the same time, that emotional charge was there. I was hit in the knee, right? So that knee injury just wouldn't heal because there was a huge emotional component there,
That's powerful.
a huge psychosomatic component.
Right.
And I think from my experience, you know, that from the traumas of my own life and observing what goes on with my patients is that at times when you're angry and you get in a car wreck,
Right.
at times when you hurt yourself because you're angry,
Right.
you know, like at times when there's abuse where you're in great fear or distress and you're hurt, those kind of things leave huge psychosomatic influence.
Right.
And even what I find is the very subtle injuries, you know, the things that people, you know, they hurt themselves, they fall and get the wind knocked out of them, and they jump up and they walk it off.
Right.
Even those leave scars, emotional, you know, psychosomatic scars. And it's important to remove those things, or you'll have an experience very similar to what you had, where you know, you come out of the trauma experience and you don't quite have your bearings.
Right.
You're not quite thinking fully anymore. You're shut down.
And I think one of the best ways that we've discussed it is, you know, when you are injured, you're in a state of grief because you've lost a piece of yourself.
Right.
You really have. And I was thinking the other day, I mean, now, you know, we're going to jump forward just for a second. Once all the pain's gone,
Right.
your brain is actually able to process information that's otherwise been trivialized or normalized, for lack of a better word. And surgery is a very traumatic experience.
Yeah.
You know, for any of those that have gone through it, and we don't see it that way, especially as an athlete. It's like, you're tough, you do this, you need to do it to keep playing. And when your quad is being reattached, your shoulder, or whatever it is, that's an experience that needs to be processed. You know, there was something leading up to it that either emotionally you were vulnerable in that area of your body that allowed the injury. Right. At the same time, what was going on and you were injured, what's complementing that as far as the surgery and your mental health or your wellness?
Right. Yeah. So in my practice, my specific emphasis is on finding trauma, and a lot of times these traumas are asymptomatic. Right. You don't even know they're there. Right. Like, for instance, in your case, you had things that were obviously hurting you. Right. But when we did a global screening assessment, we found that there were things that you weren't really aware of.
No. I do want to give an example. There was one where I knew something was off about my hips and my lower sacrum, right? And then Dr. Groover asked, well, has anyone ever jumped on your back, or you ever had an instance or a play where maybe your leg got jammed? And I remember the exact play. I hadn't thought of it until that play, right? Till the moment you asked, that, has anyone ever jumped on your back? I remember a defensive lineman jumping on the pile and feeling my hip, and it felt like it just jammed up. Right. And never thought of it since. It was like, wow, it wasn't painful, but at the same time, that wasn't pleasant. Right. Okay, I'll just run it off. Right. And from that point on, 15 years later, instead of my hips doing this nice fluid movement, this is stuck, and it's got kind of this movement. Right. Which, as you know, I mean, compensation all over my body. Yeah, yeah. So what we do here is we look at symmetry and we look at muscle strength. Those are two major determining factors, right. You know. And so when you come in here, we measure your hip, your knee muscle strengths, your shoulder, and triceps. Those are the primary ones. And if there are elbow misalignments, you'll see that, because the trauma is there. It's knocked the elbow out of its neutral position, and there's a trauma in that joint. Right. And so your triceps will be weak. And based on where the wrist is, we'll know quite a bit about what the misalignment could be, and the need for an evaluation and for treatment of the elbow. Well, the same is true with your low back, your pelvis, your shoulders, so on. So what we find here is that when we clear the body of traumas, everything from toes, feet, ankles, knees, hips, sockets, sacroiliac joints, low back, upper back, neck, ribs, shoulders, elbows, wrists, hands and fingers, and the temporomandibular joint, then the mental experience is different. It is different. I remember calling you immediately, I think after a third session or so together, where it was the first time since I was 19 years old that I had no pain. Right. No pain. And I had to share that immediately, right? Like, that blew my mind, because you don't realize how bad you're hurting until someone gives you dangles that carrot of hope in front of your face, and then you actually experience it. And then I call you and you're like, well, your consciousness is really going to be alive, because it's not walking around in pain, dealing with this physical pain and being, I guess, distracted in a sense. Right. So I'd wake up at 5 in the morning and start processing information that happened since I was 10 and on, and realizing how I was subconscious level making these decisions, and I was actually putting it together and able to see, like, almost to date. Right. And it helps with how do you know who you are in everything you do if you don't even know what's been sourcing it. Right. And pain is a source of fear. So when people come in my office and they're talking about, I'm anxious, or I'm stressed out, I'm depressed. I mean, stress is fear. We don't call it, especially athletes come in the office, they don't call it. What are you afraid of? Right. And if you're using that as a motivation to be the best, or you're using it as a motivation to never feel that again, it's still sourcing your decisions.
Right. I remember you told me recently that you felt braver in the weight room.
I did.
You know, and
So,
I've never heard
right.
anybody say that before,
Okay.
but I mean, just, you know, it implies that your previous injuries were keeping you
Right.
from experiencing your potential for activity.
Right.
That you
And
were
that is-
holding back.
That is what we're talking about, is tapping into human potential. Right?
Yes.
Right. I mean, that's the
My favorite topic.
right, right.
Yeah.
And that's an exciting thing. And I know, and we'll get around to it in a second, but we're talking about when the upper cervical is aligned. And I had, we'll get into it, but I had serious pressure on my brainstem. And once that adjustment was made, the next day I walk to the weight room, where always I look at the Swiss balls, or always I look at this, my brain says, no, don't do that. I jumped right on top of it and was able to balance myself on a Swiss ball and do squats. I was able to do dumbbells on a Swiss ball, just standing on it, doing squats, something I never even thought that I could do. Because my upper cervical and everything was misaligned here, my body was constantly doing calculations for everything.
Right.
Everything.
Rather than just doing it.
Rather than just
There
doing
had to be all these compensatory calculations. And
Right.
yeah, so the upper cervical spine, just to clarify, that's the area where your head meets your neck. And that's an incredible neurological hotbed for synapses and for nerves to pass through from the brain all the way down into every part of your body. And when that area goes out, there's a breakdown in regulation
Right.
that happens. And that regulation affects all your organs and systems, but from a functional point of view, you really notice it with the muscles, because it immediately causes a distortion of the posture.
Right.
So you'll have a high and low hip and a short and long leg, and your hips will be shifted one way or the other off of the true center of gravity, which is a line bisecting your heels and going, you know, perpendicular to that plane where you're standing, and your upper back will be shifted over one way or the other. So there occurs a lot of gravitational stress, a lot of muscular stress, a lot of neurological stress, and it'll turn into eventually, you know, inflammation and pain.
Right.
But in the interim, what happens is that you lose functionality. You lose a sense of balance and coordination, strength.
Right.
And that then, as you're saying, it translates into an entire mind-body component.
Right.
Yeah, it changes your behavior.
Right.
Yeah,
Because to even give it further description, I guess it's your atlas and your axis.
correct.
Right, it's these two bones, very way out there. And I'd never understood this. An atlas it's Greek or something, right? Like holding the world.
Atlas holds the world.
Holds the world, right?
Yeah.
And so it's the only one, especially in contact athletes out there. If I would have had you years and years ago, and like you told your son that played football, like keep your chin tucked in, because it actually protects those upper bones and the
Yeah.
upper cervical.
Chin down, head back. So you
Right.
engage those muscles. That's your neck stabilizer. So, and I treated a lot of football players, and you know, people ask me, well, isn't that like a accident ready to happen, because they're just going to go right out and bonk their head off the center of their neck again?
Right.
I said, no, particularly if they're conscious that they're going to be hitting someone or someone's
Right.
going to hit them. They just stabilize.
Because you're most vulnerable when the head is up.
When the head
Right,
is up,
right,
and yeah, right,
Right.
yeah. So yeah, that's really interesting, and we've had players, I've observed them before and after, right after a big hit to the head.
Right.
You know, our quarterback in high school got hit in the head really badly when he was playing at CU.
Right.
And I think he might have been there when you were.
Craig
Yeah,
Oaks, great
yeah.
guy.
Yeah. And so what you notice right away, and we saw that in Wyoming where my son was playing later on, that the quarterback would get hit in the head, and then they walk by me in the training room, and their pelvis would be here and their head would be over here.
Mm-hmm.
They'd be all distorted.
Mm-hmm.
And from that moment on, the timing was off.
Right.
They couldn't quite connect with their long receivers. You know,
Right.
there would be hard time, even shooting short passes,
Right.
because it's just like the timing would be off. They just wouldn't hit that sweet spot anymore, that magical moment where the ball goes down the field and it perfectly timed so that it falls in the fingertips of the receiver.
Right.
You didn't see that anymore out of these players.
Right.
And until that upper cervical spine is fixed, that distortion of the posture is eliminated, and all that distress is taken out of the body, that's pretty much what you'll have then from that
Right.
point on.
And I think one of the most powerful things was my atlas was off, I think, 4 degrees this way, and access was this way. And you made it very clear to me when you measured my legs that it's rare. It's rare for anyone to actually have a longer leg. Like when we're talking about actual bone and the actual length being a different size.
Correct.
And as you said, after I correct this, aside from having no more pressure on your brainstem and everything being able to adjust after that, is that your legs will be completely even.
Yes.
And that's exactly what happened.
Yeah.
Which was just amazing.
Well, it happens every time.
Right.
Unless you do have a bone length abnormality.
Which is rare.
Yeah.
Right.
So now, let's get down to some information that's kind of that we share, all right? Some work that we share. So what we're really talking about is the need to remove trauma from your body.
Right.
The need to remove it all, because then you'll have the capacity for, using your mind more fully and your emotions more fully and perceiving more fully and having a better life because you're pain-free. Okay?
Be present with all your
To
experiences.
to live in the moment, instead of in the past. A lot of us have been hurt in car wrecks or sports injuries or big falls or fights or however we got beat up, and we're still living in the past, and that's because those traumas kind of stopped us there at the moment where we were injured, and we live in that moment most of the time. It really strongly influences our present and our future life.
Right.
So we want to clear that out. So the way that we've seen working together, and we just got to know each other recently, is that when I'm done, clearing out the mechanical problems in the joints of the body, getting the muscles balanced, getting the nerves balanced and everything, and there's still some trauma that remains, and some coaching that can be done to help people restore their health and optimize their performance. I mean, maybe you have been out of working out for many years because you've been so injured.
Right.
Well, then there's going to be a transition time if you want to get back into full performance physically.
Right.
So there's some help that you can offer there with your institute. So can you explain what you're doing there right now?
I can. I'm really passionate about helping either young adults, that's high school, collegiate athletes, and fitness-minded adults. Really help them through all those transitions and to recognize what sourcing, as I've mentioned before, all their decisions in life. And we'll really get into the reprogramming, or a lot of things that we've been taught how to think. I need to get into what's been there. What is the emotional pain? And when I do EMDR, that's eye movement desensitization and reprocessing. And I explain that more on my website, drjudd.com. And what I do is I bring someone up and, for a clinical term, have them activated. I think about that injury, I think about that circumstance, I think about the abuse, the trauma. What do you envision? What's the imagery that pops up? What's the negative cognition that comes up? And really get you activated and recognize, scan your body somatically from head to toe, what comes up. And usually, as an example, I feel something in my lower abdominals, right? Well, typically that's something to do with something around shame, maybe even guilt, because it works usually going all the way up to the different zones of the body. It's fear, guilt, shame. There's some type of loss here, communication, right? Lies that we've told ourselves. Here is separation from community, people, loved ones. And really having people recognizing the connection so they can feel it instead of, just my stomach hurts, or then that's a vulnerable area where those emotions are really aligned with whatever trauma's taken place. And then I can help you process that trauma and that information. And your brain and your body is very powerful. When it's ready and it's in a healthy environment to do so, it's able to process those things, and you're able to be more present, as we've mentioned, to go on and do life however you want to do it, instead of it actually happening to you.
Yes.
Right?
Yeah, and I think that it's very important to understand that when you get injured, there's a physical component, but also at the time of the injury.
Right.
There are emotions, there's mental experience, there are sensations, the feeling of pain. All of that is stored in every part of your body,
Right.
including your mind.
Right.
All right. So you're stuck there, and in my work, what I try and do is take care of all of the physiological components, and a lot of times we see people crying,
Right. Breakdown.
because they're getting that relief, and their emotions, their mind, they're releasing that.
And sometimes they're brought right back to that moment.
Yeah.
Yeah.
And then the other part of it is that a lot of times the processing can be greatly enhanced or must actually be done doing a more mental process.
Right.
Yeah. So that's where you come in, see? And what I find is that when I'm working with trauma release, and I've done some of it here in my own office, that the mental processing, the emotional mental processing is much, much, much more successful. In fact, it can be completely successful rather than just tiny incremental improvement when all the physiological trauma has been eliminated.
Right.
So it really opens up the opportunity to clear the trauma and to get really sharp in your thinking and the way you're feeling and perceiving life, so that when you evaluate what's happening to you, which we do at every moment,
Right.
you'll have a great deal of what we would say accuracy.
Right.
Yeah, that would be a...
And I think one of the biggest things to point out is that we're not strictly talking about contact athletes or patients.
Right.
Because you and I have evaluated and talked to an athlete, and they aren't into contact sports, and they think they're looking straight ahead and their axis is off, just like this, and they think they're looking directly at us.
Yeah.
And that's why I start, and that's why immediately when we started talking was, well, everyone's probably upper cervical needs to be checked. Make sure that everything's healthy. Otherwise, you don't know what pain.
We've all grown up playing in our playgrounds and in our yards and neighborhoods with our brothers and sisters and friends as children, and fallen flat on our faces.
Right.
Had the wind knocked out of us and jumped right back up and got into the pack,
Right.
and not even thought about it,
Right.
And we've all, learned to ride bikes and crashed, and, all those things. And, here in Boulder, we have a huge bicycling community, and we don't think of that as a contact sport, but I'll tell you,
they'll disagree.
when one of those riders goes down
Right.
on a road, at a higher speed, it's really devastating. It can really mess you up. I've had ski skaters come in and fallen down and smashed up their shoulder. I've had snowboarders regular skiing, all sorts of things. Of course, there's the usual thing like baseball where, people get clobbered sliding into home plate, or they run into another player out in the field or whatever, or repetitive injuries like batting and pitching and stuff like that. Those are pretty typical for us. Another thing that surprised me was when I had my first experience treating a NBA player, because I never thought of basketball as a contact sport.
Right.
But it is. What you don't see is what goes on up close with those players. And this man was big, obviously, and he was so strong. He was stronger than any person I've ever tested. I tested muscles, and he could just, if I wasn't careful, he would throw me across the room.
Right.
And so the point I want to make is that most people that play any sport get injured.
Right.
Because we're pushing the envelope.
Right.
If we're performing.
Right.
And we're taking risks.
Right.
And if you're cycling and you decide you're going to come around that curve really fast because you can get ahead that way.
Right.
A lot of times you'll take that risk.
Right.
And if there's a little pebble on the road or something, that could be a problem. So anyway, there's Yeah, you're right.
I think at the same time when we're pointing out how it's not strictly for contact athletes and what we're talking about, it's also whatever emotional trauma is coming up, it manifests in very unique ways. I'm thinking immediately of a patient that came in, and this is a woman that's in her 50s, and she has been an extreme athlete her whole life. At the same time, she just thought we were working on something small with EMDR or any kind of trauma protocol and kind of working through that. She was petrified, terrified of cockroaches. She would run out of the room. And when I started having her envision, what is it, the flappy wings, the legs, everything that got her activated, was this negative belief she had to her core about herself. Well, it was like, oh, I'm not strong enough because I'm scared of this small little thing. And, when I had her scan her body somatically, now she's kind of getting like, oh, I feel this tightness in my chest, and there's a loss here. So when I had her float back, what's her earliest memory she can ever feeling that way? Something she hasn't thought of since she was 5 years old. She fell out of a treehouse, broke her leg. Next thing she knows, she's right there in the hospital with her parents. They're speaking Spanish. She doesn't know what they're saying, and there's a cockroach on the floor.
Huh.
Right? So she's already, to watch her process that information and see that the cockroach was the focus, aside from her inability to communicate. Right? Now, this is my story of how I'm processing it for. Everyone does it differently. All our brains, figure this stuff out. And it's really amazing that she never really was able at such a young age to process this physical pain with this really scary situation of a hospital and her parents arguing, and that was fearful and scary, and they saw the anger and all the different emotion that came around to it. And so you have this psychosomatic, the mind-body connection, and everything from that point on. We have traumas just like injuries. Like one thing happens here, well, it's going to affect over here. Well, one thing emotionally happens here, we're kind of stuck in that area, and they're just stacking on top of each other.
Right.
And we need it, and that's how I've always seen as upper cervical works. Like we adjust this, then I can go to shoulders, then I can go, and that was the biggest part with me finding you.
Right.
Was that not only there's very few upper cervical or NUCCA chiropractors out there. I think, how many in the country?
Well, we usually say a handful, but
Right.
maybe it's grown to 100 now.
Maybe, right? Yeah. And so my mentor, Paul Check, got me into upper cervical care. That's what really got me into the holistic wellness. And he said, you got to do this. Okay, I got to do this. And not only did I see, well, upper cervical is important, once this adjusted, well, I still have all 6 joints in my shoulder out of whack, right? Very few chiropractors work in extremities as a complement to upper cervical care, as well as even work in extremities, correct? Right? So not many are going to know to test and adjust all 6 of these joints, get my hip back in line, right? Get my pelvis realigned and everything. So that's how I really saw it, as being this symbiotic relationship of upper cervical care and then caring for the extremities of the body, which are all trauma.
Yeah.
And then I kind of see as whatever happened at an early developmental stage and having someone stuck there. Right. And then all those injuries or trauma just stacks on top of each other.
Yeah, and it's really interesting to note that, in a sense, stress is stress.
Right.
And stress is cumulative. So like you start out with a little knot, and then over a lifetime it develops into a big ball of stress.
Right.
All right? And the physical stress, the trauma to a joint, like let's say when you're little and you fall like I did riding a giant English bicycle, run into the curb and crash your hip on the curb really hard. Let's say that's your experience, and so you get a knot, right? Right. And then something happens later where your mother balls you out for going into her purse.
Right.
And so there's another knot.
Right.
And then, by the time you're in high school, you've got a nice ball. Right. Then you get to be adult, and these physical and emotional traumas build up. Right. They're there's no real differentiation there. It's just trauma, And so what I see is that the obvious easy thing to do for me is to take care of the physiological trauma.
Right.
and get rid of like this incredible amount of stress, like to reduce that ball down to something really small and manageable.
Right.
And then start doing mind-body medicine in a major way and clear the rest of that out.
Right.
And then what you're talking about is major potential for human development.
Right.
You know, and my interests, and I know we've agreed on this, in that, you know, you hear these broad brush statements that humans probably today only use about 10% of their mental potential.
Right.
You know, that there's a huge band of experience.
Right. We're tapping in what is possible.
The other 90% where, you know, you don't even know it's there, you don't even know that it's missing.
Right.
And there have been people throughout history who have discovered that, who've had an experience of it. I think athletes a lot of times, they like that adrenaline rush because it expands their bandwidth,
Right.
you know, from 10 maybe to 20
Right.
temporarily.
Right. Right.
Or when you fall in love, it expands your bandwidth, okay?
Right.
You know, some people have used drugs and said that it's done for them. And some people just fall into it spontaneously. I know for me, I meditate twice a day. I have a specific, I do TM, and you know, and it really works for me.
Right.
To keep my bandwidth open and keep it growing, you know.
Right.
So the point I want to make is that we really haven't really begun to explore what's humanly possible, really, as a, you know, as a society, as a culture. You know, there have been esoteric sages, you know, off in remote parts of the world that have.
Right. And I think where my mind immediately goes that for that to become possible is for all of us to start thinking proactively instead of reactively. Because I think, as we know, most patients that come in our office aren't coming in on a winning streak. I mean, it's pain. The pain teacher is right there in their face, you know, and it's there's no other option. I have to do something about it, and they're desperate. And I hope anyone watching this videos or trying to come across is, if you're in pain, let's listen to that teacher. Let's learn that lesson. If you're not in pain and it's kind of like, try to get out of the mindset as I'm going to wait until things are excruciating or things are right in my face.
Yeah.
You know, I think that's one of the most powerful, because I think that opens you up for that potential. Because when you come in emotionally distraught and physically unwell, then your entire life isn't in a place for balance, isn't in a place for healing, isn't in a place for processing past or present information to live out your dreams, to live out your destiny.
Right.
And that's what we're talking about, is what is that potential? What is that possibility? Well, if you're always sitting here with this past predictor of your future behavior being pain, then probably what you're going to feel and see is pain. And if that pain isn't so severe, then you're kind of in this limbo.
Right.
You know, we're trying to get people out of the limbo. And this is me. I mean, all the clinical work and the education that I've had, and then the mentors I come across, and especially like you, and I realize, like, I'm just barely tapping into that potential. Just starting, you know, just starting, and it's exciting. And I want to share that, and I want to give it to people.
Well, I appreciate that, Dr. Judd, and that's been a really very interesting and inspiring conversation.
Right.
And we hope to have you back again soon.
Definitely. We're going to do this again.
Thank you.